the wild rains of Argyll,
under Glasgow's steady grey,
worked a quiet Scottish doctor
who saw trauma in a different way.
Dr. Frank Corrigan, psychiatrist, decades deep in dissociation scene.
He watched the body tell its stories in the spaces between the screen.
He saw how memories fracture,
how the midbrain holds the key, how the shock before emotion shapes the whole anatomy.
Deep brain reorienting,
born in a room where silence spoke,
where the superior colliculus trembled
before a patient even broke.
Orienting tension, pre-effective shock,
The PAG's old echo of pain.
Frank mapped the hidden sequence that the survival brain ran again and again and again. For years he treated dissociation,
Shut down, overwhelmed, lost self-states,
the numbing, blanking, splitting.
the attachment fear that never abates,
He saw how shock returns too quickly,
how affect rises like a tide,
how survivors brace against remembering and tuck their terror deep inside.
He followed each subtle tightening
Every forehead flick, every neck small turn,
and realized healing must begin where the earliest circuits burn.
not top-down talk, not managing symptoms, but the body's own route to free, following the orienting tension back to the moment the world split in three. DBR grew from Scottish soil,
From a clinician who refused to look away,
a map of shock, effect and defense in the midbrain's first relay.
he saw the superior colliculus call,
The locus coeruleus flashing through,
and he built a method gently for the brain to orient anew.
Then one day in the UK's teaching halls, another craftsman crossed his path.
Martin Warner, Alexander Master, with a lifetime of releasing tension's wrath,
He'd worked 40 years with bracing,
with armoring fear collapse,
and saw how bodies shut themselves when memory stirs and snaps.
Together they studied the moment,
That split-second clamp before effect arrives.
and Martin brought IT wisdom to help free the storms inside their lives.
With Frank's midbrain sequencing,
Orienting tension, shock and effect,
and Martin's Alexandrian insight, analyze conditions present, intercept a construct, dismantle in effect. They disarm the oldest bracing
that trauma taught to protect.
They made somatic interweaves to dismantle old defenses tight.
The bracing against terror,
The armor against fright, the clench against overwhelm, the freeze against the night. The collaboration,
Frank brought the trauma map, the neuroscience, the pain made clear,
decades with dissociative patients
who needed someone to stay near.
Martin brought the movement art, the subtle cues to deconstruct the axial line, helping the body to stay present while the shock became less intertwined.
And together they shape the doorway
For survivors to move through,
with DBR as the compass and IT interweaves helping shock move through.
Deep brain
reorienting,
a Scottish hymn of healing slow,
born from Frank's long dedication to the depths few dare to go.
and the AT interweaves the gentle tools that soften bracing's ancient hold.
Crafted with Martin's guiding wisdom in hand, so the buried stories can unfold.
So here's to Dr. Corrigan,
Arguel's quiet midbrain sage,
who charted shock's deep architecture page by trembling page.
and here's to Martin Warner, the somatic craftsman with decades in his stance.
A Jungian traveled mind with Alexander hands, running workshops from Boston to Iceland,
Croatia to Monterey Bay,
Sydney's bright coast, Seattle's soft rain, from Auckland to Edinburgh, Toronto to El Paso, and Stockholm to Gaborone. Each room a
place where armoring fell away.
together they made a pathway through the old